Good evening. Welcome to our SSM Health panel discussion on pregnancy during a pandemic. My name's Becky Bodeker. I'm one of the lactation consultants at SSM St. Mary's Hospital, and I'll be helping to moderate the event tonight. And I'll also be chiming in some with my own experience as a nurse working with new moms and babies during this pandemic period. It's really important for me to mention first that things change every day since the beginning of this pandemic. Things, our recommendations and policies have changed very rapidly sometimes, and they'll continue to do so. So what we're speaking to tonight is today, this moment in time. So that's what our answers will be, is for today. So tonight we want to talk through some things that you might want to think about during your pregnancy, reassure you about the safety of delivering in one of our hospitals, and inform you on what to expect in the birth experience. We won't be answering direct questions from participants, but we have reviewed many questions that expectant mothers have been asking. And so we hope that we'll cover most of the things that you need to know. And we can always continue the conversation beyond this panel discussion on any of our SSM social media pages. The Zoom tonight is being recorded, so you can always look back. It'll be available at ssmhealth.com/pregnancy during pandemic. And then you can always find information about our maternity services at ssmhealth.com/maternity. All right, so I think we'll go ahead and get started so we can introduce the rest of our panel. First, how about Dr. Jane? Would you like to start and introduce yourself?
Absolutely, Becky, thank you. I'm Dr. Sonali Jane. I'm an SSM OBGYN, and I practice at the Sunset Hills location. I deliver at SSM hospitals, and we'll be able to answer some questions along with Becky about what our policies are at hospitals with moms and babies.
Thank you. All right, and we also have Dr. Childress joining us from our partnering SLU Care Physician Group. Dr. Childress?
Hi, yeah, I'm Katie Childress. I am one of the maternal fetal medicine specialists, which essentially is high risk obstetrics. And I work for SLU Care, but also we do a lot of consulting and deliveries at through St. Mary's and the SSM system.
Okay, thank you. Well, why don't we get started with our questions? So the first question has to do about safety. Is it safe to be pregnant right now? Dr. Childress?
So that's probably our biggest question of the day. This is just a scary time. And I think the thought of pregnancy and the feelings about being pregnant right now just heightens even more of those emotions and the uncertainties that we're all facing right now. But there are a lot of things that we can do and pregnant moms can do to really mitigate those risks right now. All the things that we stress all the time, like mask wearing and just being really vigilant about that. Hand hygiene, being careful about who you're around and who your bubble is. So just being very vigilant and then trying to avoid unnecessary outings and social events, especially large groups. I think all of those things can really make pregnancy a safe thing to still be pregnant at this time. Just following all those protocols and things that we advise.
Okay, thank you. The second question, are there increased symptoms for me if I'm pregnant and contract COVID-19? Dr. Jane?
So there are certain reports that have come out that pregnant women may be at a higher risk of severe illness or getting more sick when they contract the COVID-19 virus. They may have a higher risk of getting admitted to the ICU or getting on a ventilator. And certainly these risks may be even higher for some pregnant women who have other medical problems like diabetes in pregnancy or obesity. These are related to changes that happen in our lungs and in our heart in pregnancy, in our immune status. So all these do put pregnant moms at a little bit of a higher risk compared to non-pregnant women. And then there is a little increased risk of having the baby early or preterm delivery. But it needs to be stressed that a lot is not known about this disease, and we are learning more about it. So as our goal is to educate our patients more as we know more.
Okay, thank you. And part of what you mentioned about delivering early, the next question is, how about my baby? Is the fetus at risk if I contract COVID-19? Dr. Childress?
Sure, I would echo, I think this question echoes some of what Dr. Jane just said. We're still learning a lot about COVID, and as we have more and more information, as unfortunately more pregnant women are contracting COVID and experiencing it, we are learning more about that. We do think, though, in general, most pregnancies that are affected by COVID infection still seem to have pretty low risk of effects on the baby. I think, again, this is as of November 10th, we think the risks in general are pretty low. There is some data, though, that we're learning that there may be higher risks of things like preterm birth. And again, that can be because of many factors considered and some of the other medical situations that may be happening at the time. There may be some effects on things like fetal growth and some other things that we just don't know yet. But still, in general, I think the data overall are pretty reassuring, especially in milder infections. This, again, the underlying theme, though, is going to be to, if you have concerns, think you have COVID, or test positive for COVID, to make sure that you let your doctor know so that any updated guidelines or recommendations can be applied to your pregnancy, and we can be monitoring you as in the way that we think is best and is recommended at the current time.
Okay, thank you. So what about going to your prenatal appointments? Are your medical offices safe for women to come in for their prenatal visits? And can they do any of them virtually? Dr. Jane?
Yeah, very good question. And I know that's a question that a lot of our pregnant moms have. Can I come to the office? Will I get an infection if I come to the office? All our offices are taking very appropriate precautions so that we can provide safe care. I think it is very important, and especially in a pandemic, that pregnant women get proper prenatal care, regular prenatal care, stay healthy, and follow the recommendations. So absolutely, the offices are safe and are taking all the care that is needed to provide the prenatal care in a very safe fashion. Can some of these visits be done virtually? Yes, some of them can be done virtually, and that is a discussion between you and your obstetric provider to see if that is a possibility. But yes, some of these visits can be done virtually, but not all of them. So coming to the office for regular prenatal care is very important.
Okay, thank you. The next question, if I'm pregnant, should I get a flu shot?
Very good question again. So absolutely. We have always recommended that pregnant women get 2 shots, the flu shot when it's flu season, for their safety and for their baby's safety, if the baby is going to be born during flu season, and also the Tdap shots. So keeping up to date on both shots is very important and very safe. And a lot of the offices, the obstetric offices, will provide those. So absolutely very important to keep up to date on those.
Okay. We've heard a lot about vaccines in the last couple of days, the COVID vaccine. So if I'm pregnant, will I be able to get the COVID-19 vaccine when it's released? Dr. Childress.
That is a great question. And we are really hopeful that that is on the horizon. Again, I think that's a little bit of an unknown, but so far as I'm aware, all of the vaccines that are the top candidates and in the most advanced phases right now of trials are made are not made with the live virus. And so generally speaking, those are vaccines that are safe during pregnancy to get. And we will have to see ultimately which company is approved first and is we're administering more widespreadly through the country, and what their recommendations are specifically for various groups, those at highest risk, and what their recommendations are for pregnancy. But it probably will be safe. We'll just need to know a little bit more information when we know which one is the one that we are using.
Okay, good. So we want to stay tuned and talk to your provider about that when we get more news. Okay, the next question, are hospitals safe for me to deliver in right now? And I'll take that one first. I've been working full-time this whole time during the pandemic with new moms and babies. And I can confidently say the hospital is one of the safest places to be right now. Everyone who enters the building, whether it's a visitor or a patient or a doctor or a nurse, has to be screened. They're screened with questions about symptoms and also have your temperature taken. And then once you're in the hospital, you wear a mask. So I feel like it's a very controlled situation here in the hospital, and that makes me feel very safe. Would anybody like to add anything about
Yeah,
that?
I would say the same thing and just reiterate that the hospitals are very safe right now. We are taking a lot of precautions. We, just like Becky was saying, we do all the screening, including temperature checks. I joked at the beginning of all this that to my family that I feel safer in the hospital than I do going to the grocery store and going to work. And so I've always been very comfortable going to work and being in the hospital. The hospital remains the safest place to have your baby and is safer than having other options out there. I know that some people have talked about increased home births, but the hospital setting is still the safest place to have your baby.
Okay, thank you. The next topic is visitors. That's these are some questions that are on everyone's mind. What is the visitor protocol? Can I bring my partner or do I have to deliver alone? And I'll answer that. In all of the SSM birthing hospitals in St. Louis, women are allowed to have 2 support people with them, 2 healthy adults. So we don't want anybody who's COVID positive or who's symptomatic, but 2 healthy adults with them throughout their labor and delivery. And if you want to bring a doula or your midwife or some other support person, they would just be included as one of your 2 support people.
And the other thing that I would like to stress on there is, as Becky said in the beginning of our conversation, this is as of today.
Right.
Everything is being done to keep patients safe, our babies safe, pregnant moms safe. And if that changes, that will be communicated to you by your provider. But as of today, yes, 2 adult healthy visitors are allowed in our labor and delivery.
Okay, thank you. Masking policies. What is the masking policy for my partner and the care team while I'm in the labor and delivery unit? And I can answer that. Members of the care team will be always wearing appropriate masks and eyewear if that's appropriate whenever they're in patient care areas. And visitors are asked to wear a mask at all times. And then the next part is, do I need to wear a mask during labor? That's what a lot of women are worried about, wearing a mask during labor. And the answer is moms are encouraged to wear a mask if they leave their room and, for instance, walking in the halls during labor. Definitely mom needs to have a mask. Support people need to have a mask on. When anyone enters your room, anyone from the healthcare team enters your room, we ask that you put a mask on. But having said that, we do understand that there are times in labor, for instance, pushing, et cetera, where a mask is just not possible for the birthing mother. Okay, the next question for Dr. Childress. Do I need to be tested prior to being admitted to our labor and delivery unit?
So right now, we, again, this is, and I said this wrong date earlier, it's November 11th. We are not universally testing all of our pregnant moms before they come in, either when they come in labor, before a scheduled C-section, or before a scheduled induction. We are doing symptomatic-based testing, which means essentially, if you have symptoms, that's when we would move forward with testing you. But no, we are not universally testing all patients ahead of time now.
Okay.
And I should stress that's in the SSM system.
Right. We're speaking for the SSM birthing hospitals right now. Okay. So if I'm COVID positive, so this is a whole nother set of rules if you are definitely COVID positive. So if I'm COVID positive, can I have someone with me in labor? And what are the visiting policies? Dr. Childress, do you want me to take that?
Yeah, go ahead.
Okay, well, the hospital policies might vary a little bit, but in general, moms can have one healthy adult person with them. If you're COVID positive, you can have one person with you throughout your stay. We ask that it be the same person the whole time, and that you won't be leaving the room. Neither mom nor your support person will be leaving the room. Again, they'll wear a mask if the healthcare team comes in the room. And we will also provide meal trays for your support person so that they, can be fed while they're there with you. But no other visitors. And then the next question is, am I going to be separated from my baby after he or she is born? That's a big one. Dr. Jane, do you want to take that?
Yes, Becky. That's a question that's been asked by a lot of moms that are worried about that. We all know, and American Academy of Pediatrics has said this too, that early and close contact between mother and the newborn is essential, and that's why all our hospitals have the policy of rooming in, meaning that the healthy baby, is in the room with the mom at all times. And COVID does not change that. The mom and baby are not separated. The baby stays in the room with the mom. If a mom is COVID positive, it is important for the mom to wear a mask and practice hand hygiene while taking care of the baby, and keeping a distance of more than 6 feet from the baby when not taking direct care of the baby. So using those precautions, the risk of infection has been noted to be very low. So we are continuing to have moms and babies in the same room.
Good. I'm sure that makes a lot of people feel better because we've all heard stories about babies being taken away. So the next question is about breastfeeding, and that's my area of expertise. Is it okay to breastfeed? So the answer is yes. It's not only okay, but it's recommended that you breastfeed. We know that mothers who have been exposed to any infection produce antibodies against that infection, and those antibodies are passed through their milk. So their baby gets additional protection against, if you have COVID, they'll have additional protection against COVID. If the flu is out there and you're exposed, you'll have additional protection against the flu, and just anything, any other infection that's out there. But I think the key is knowing that this is a respiratory infection. We know how it's passed. And so we do have moms, if you are COVID positive, if you're going to be holding your baby, whether you're breastfeeding or bottle feeding, you'll wear a mask and use good hand hygiene. But there's no reason for you to not breastfeed. It's really important for both of you. All right, the next question, preparing for delivery. Should I quarantine before giving birth or throughout my pregnancy? Dr. Childress, do you want to take this one?
So this is one of those questions that I will say there's been a little bit of conflicting advice about over time and as things have changed. But right now we are not telling pregnant women that they need to quarantine. I do personally recommend that moms be even more vigilant, though, the closer that they get to delivery, and to try to really avoid any potential risk of getting COVID, or where they may contract COVID in the weeks just leading up to delivery. And so just being very vigilant about wearing that mask, protecting themselves, hand hygiene, and really limiting people that they're around, and making sure, again, that the people that they're exposed to are also following these guidelines, because that's just as important. But no, we're not recommending specific, very stringent quarantine at this point.
Okay. Dr. Jane, would my length of stay at the hospital be any different because of COVID-19?
So not necessarily. The postpartum period is to make sure that the mom is recovering well. Breastfeeding, Becky, that you take care of is a very important part of that postpartum period. So we want to only discharge the mom and the baby when both are get ready to get out of the hospital, which does matter on the type of delivery that you have, but not necessarily are we restricting the stay in the hospital. We stress that in labor and delivery, we are taking care we're taking utmost care to prevent infection, and that is the same as in the postpartum floors as well. All our care providers are masked, everybody's using hand hygiene. So we continue to take all those safety precautions. So the goal is to provide the help that the mom needs and make sure the mom and baby are fit for discharge before they go home.
Okay, good. All right, going home. This is the next question is, what are the recommendations for visitors when we bring the baby home? Should I limit the contact the baby has with others? I'm going to throw that out there to both of you.
So I would say for this question, it's a good idea to ask your pediatrician specifically, because they may have further recommendations and know what the most up-to-date guidelines are. But in general, I tell moms, this is the time to be mama bear. And even without COVID, you have to be very cautious about who's around your baby. We all want to share our new babies with the people that are most important in our lives, but just to be very cautious about the people who are visiting, again, trying to maintain sort of that bubble and knowing that the people who are coming to visit you and your baby are people that you trust and are following these guidelines. You're trusting them that they're following these same guidelines when they're out in the world too. But we also recognize that new moms need help too. And it's very difficult to say to completely isolate, but just to be, to try to have the same people that are coming and to really just limit it to the most important people and the people that are going to be helping you the most and that you trust are doing as much as they can to minimize their risks of infection too.
Yeah, I totally agree with what Dr. Childress said. There is no way to ensure zero risk of infection, but it is just important to understand the risks and how to be as safe as possible. The more people you interact with, the more closely you interact with, and longer the interaction, the higher your risk of getting infection, especially during flu season and now this pandemic. So it is just important to realize that and take all your precautions.
That would be one more thing. I'm a huge proponent of the flu shot, but to make sure this year more than ever, to make sure that those who are coming to visit your baby are getting their flu shot, that they're up to date, and that when they come to visit, that they're using their, hand hygiene before anybody, as soon as they walk in the door and before they touch your baby, and just really minimize the risks to baby.
Okay, well, those are all the questions that we have. Thanks again to our panelists, Dr. Jane and Dr. Childress, and to all of you who have joined us tonight. I hope you found the panel discussion valuable as you try to navigate your way through your pregnancy at this challenging time. Again, please visit our website for more information on maternity services or to find an OBGYN in your area. You can also find links to virtual childbirth classes and support groups take a virtual tour of the labor and delivery units at our 4 maternity hospitals, St. Mary's, St. Clair, St. Joseph in Lake St. Louis, and DePaul. We will be posting this Zoom discussion at ssmhealth.com/pregnancy during pandemic. And we'll continue to educate and inform on this topic throughout our social media pages. If there are changes in any of these things, which there may be several times before you deliver, just keep in touch with your doctor and keep in touch with the hospital. You can always call the hospital where you plan to deliver and ask questions of the mother-baby unit or the labor and delivery unit. So feel free to call and ask questions, keep the communication open, and best wishes to all of you. And I hope that we can continue to partner with you for a healthy pregnancy. Thank you.